Good morning. I'm Stephen Hale, the Senior Benefits Consultant in the Human Resources Department. And I just wanted to thank you for letting me present to you this morning. Open enrollment is coming up. It's coming up quickly, November 11th through the 29th. So in the past, it has been a full month of October. They've gone back to about 3 weeks. So you want to be aware of that shortened enrollment period. And please don't wait until the last day. Can you all see the screen, the presentation on the screen? Great. So don't wait until the last day. Inevitably, what happens is somebody's going to wait until the last day. They'll try to call the eligibility enrollment number and they won't be able to get through. And after the 29th, there's no more changes. So do it early, but do it once. Everybody must touch their enrollment. Health insurance, again, will be moved to the 70-30 plan. Everybody is going to be placed in the 70-30 plan, and you will need to opt out of it if you want to be in the 80-20 plan. This gives everyone the opportunity to answer that tobacco attestation credit, which has to be done every year. Even if you're a new hire who recently went through the initial enrollment process, you must do this as well. So, in order to save $60 off your monthly premium, you must attest to being a tobacco, you must attest to complete the tobacco attestation program. In addition to your health insurance, everyone must make new flexible spending account elections. So the way to complete your enrollment is to access the eBenefits portal through the Human Resources website. It's a single sign-on process, so your UNCG ID and password will get you into the enrollment portal. You don't have to remember any IDs or passwords other than the one you use every day to access your UNCG account. So that's one way to enroll, complete the online process. Your other option is to call the eligibility and enrollment call center. There's their number on the screen, and there are the extended hours during open enrollment. So they will have Saturday hours from 8 to 5 during the open enrollment period. There are no Sunday hours like there were in the past. So it's just Monday through Friday, all the way through 10 p.m. And then Saturdays from 8 until 5. You can call that eligibility and enrollment number. We will not be holding open enrollment labs due to the COVID virus. So we didn't hold them last year and it worked out fine. So we're going to stick with that plan this year as well. So either complete the online enrollment or call the eligibility and enrollment number. So let's talk about the health insurance. As I mentioned, everybody will be moved to the 70-30 plan. You'll see that in your October open enrollment portal. And it will be effective January 1st, 2022. So you must take action if you want to be in the 80-20 plan. You also must take action to complete the tobacco attestation if you want to reduce your monthly premiums. Failure to take action by October 29th will result in you remaining in the 70-30 plan for the entire year of 2022 while paying a higher premium because you failed to complete the tobacco attestation. You may also pay a higher copay when you visit your primary care provider. You need to make sure that you're listing a primary care provider on your ID card to get a reduced office copay. So that's another cost savings method. So the rates for 2022 will remain the same. So you can see the rates there on the screen. They are currently what we're paying in 2021. I'm sorry, that should say the 2022 rates in the green box there. So these are the same in 2022 as they were in 2021. So there was no increase to the employees. There was a cost increase. It was passed on to UNCG. So it's not that it didn't go up. It's just that we didn't pass the cost on to the employees, got passed on to UNCG. The rates for health insurance are collected a month in advance. So if you make any changes, you will see changes in your premium in the December payroll. So again, if you complete that tobacco attestation, you can see you saved $60 off the monthly premiums. If you are a tobacco user, you can complete the tobacco attestation anytime between now and November 30th, but you must take action. If you are a non-smoker, all you need to do is answer the tobacco attestation question in the online enrollment portal and be done. If you're a smoker and you want to receive that $60 credit, you do have to take a step in that you need to visit a CVS Minute Clinic pharmacist or visit your primary care provider. And you must do so by November 30th. If you answer the tobacco attestation question that you are a smoker, but you're willing to participate, if you haven't completed this step by November 30th, you will forfeit that $60 savings. So please be sure you complete the process. They're not providing any waivers for employees who are 25 miles away from a CVS Minute Clinic because you can now visit your primary care provider. As I mentioned, you may have attested to being a non-smoker in the past, but you have to do this every year. So please make sure you complete that step. And the state health plan is recommending that if you visit a primary care provider or a CVS Minute Clinic pharmacist for a tobacco attestation counseling session, that you hold on to your receipt and upload that into the document center found in the eBenefit portal. It's on the left-hand side of the portal, so just upload that. That's a way of making sure you have proof if for some reason they don't provide you with that $60 credit. In 2021, we added the Clear Pricing Project network. So we basically have a network within a network. We have the North Carolina State Health Plan, the Blue Cross Blue Shield network, and within that network, there is a limited number of primary care providers and specialists who have agreed to provide some pricing transparency, and the state treasurer wanted to reward those providers and employees who visit them with lower copays. So if you see a Clear Pricing Project provider and you list them on your ID card, your office copays can be reduced down to $0. There are also specialists who are in the Clear Pricing Project, and if you visit one of them, you will get an office copay reduction as well. So on this screen, you can see the copay structure. As I mentioned, if you list a primary care provider on your ID card and that provider is in the Clear Pricing Project, you will have a $0 copay under both plans. That's a huge cost savings. If you have a Clear Pricing Project, a non-Clear Pricing Project provider listed on your ID card, the copay is $10 under the 80/20 plan and $30 under the 70/30 plan. All other primary care providers who may not be listed on your ID card, the copay is $25 for the 80/20 plan and $45 for the 70/30 plan. You can see that specialists who are in the Clear Pricing Project will also receive a copay reduction. So it goes down from $80 to $40 under the 80/20 plan, $94 down to $74 for the 70/30 plan. Other specialists who are like speech therapists, occupational therapists, chiropractors, or physical therapists, they also will provide a copay reduction if you visit somebody who is in the Clear Pricing Project. So you can find, using the Find a Doctor link on the State Health Plan's website, it will link you to the Blue Cross Blue Shield website, and you can find providers who actually have a Clear Pricing Project indicator under their profile. That's the easiest way to find out who is in the Clear Pricing Project. The easiest way is to just ask the provider. They'll know if they're in the network or not. It's important to point out, so the rates didn't go up. And there's really been little change to the benefit itself that's provided through the 80/20 or the 70/30 plan. But we do like to point out that the formulary changes on a quarterly basis. This is your prescription formulary, the drug list. So it gets updated quarterly by CVS Caremark. So you want to utilize the pharmacy lookup tool and just check to see if you take a prescription on a regular basis, which prescription tier that your prescriptions will fall under. So that lookup tool could be very helpful. If you go to the State Health Plan's website, in the center of the homepage, you will find a CVS Pharmacy Resource Center. Click that link. It will take you to the lookup tool for both the 70/30 plan and the 80/20 plan. Plug in the name of the prescription and the dosage that you take, and it will tell you what the cost would be, which tier it falls under. It will also give you the cost for your mail order pharmacy, which could save you some money if you utilize that more mail order pharmacy. The only change to the benefits is the addition to a diagnostic colonoscopy copay. Currently, colonoscopies, if they're considered preventative, could be covered at 100%. Employees go in thinking they're having a preventative copay, a preventative procedure for a colonoscopy, not having to pay anything, but while you're asleep, if they find something and remove it, they've performed surgery and you could be in for a rude awakening. Now you have your deductible, your coinsurance. So that could be a financial burden to a lot of people. And it really does keep people from getting a checkup. In 2022, they will add this copay for a diagnostic colonoscopy if performed at an ambulatory surgical center. That's really any non-hospital setting. And you can see that it can be a significant cost saving. So no longer will it get applied towards your deductible. You would simply have a copay. So no more reasons to delay or put off getting your colonoscopy. So that's a huge savings. During annual open enrollment, this is your ability to add or remove dependents without a qualifying life events. During the plan year, you would need a qualifying life event in order to add or remove dependents, but during open enrollment, you can add or remove dependents as you see fit. If you add anyone, you will be required to provide documentation showing proof that those dependents are legally your dependents, and you can just upload that document within the document center. So that's the health plans. Again, very little has changed. The rates didn't change. The plan themselves haven't changed. The Clear Pricing Project isn't new. We're in the second year of that. Your NCFlex benefits, these are all the other benefits that are offered except for the health plan. So your dental, vision, flexible spending account, all of your NCFlex benefits will automatically roll over with the exception of your flexible spending account, your healthcare flexible spending account and your daycare flexible spending accounts. Those require an annual election. So you must make a new election for those benefits. Everything else, your term life insurance, accident plan, cancer, critical illness coverage, dental, vision, if you do not want to change those benefits, they will simply roll over. With the flexible spending account, the documents say 2020 participants. Oh, so in 2020, there was a rollover of up to $550 into the next plan year. Well, they extend that for 2022. If you have any money left in your account over $25, it will all roll over into this plan year. So any funds left over from 2020 that rolled over into your 2021 flexible spending account will roll over into your flexible spending account for 2022. So there is no cap for the rollover feature. Now any dollars over 25 will roll over into your healthcare flexible spending account. So you want to take that into consideration when you're making your new election for 2022. It is a pre-tax contribution, so it's lowering your taxable income. It can be used for any out-of-pocket medical, dental, or vision expenses for you or your entire family. The maximum that you can contribute in 2022 will be $2,750. It does have the use it or lose it rule, which again, under the COVID CARES Act, that cap of $550 has been removed. and any funds over $25 will roll over into the next plan year. At the end of 2022, that cap may not be extended. So, I mean, that no cap may not be extended, and we're looking at $550 rolling over into 2023. So we need to watch that to see if they update that going forward, but you just plan accordingly. And for the dependent daycare, the amounts didn't change. You can still contribute up to $5,000 into that per year. This plan does have a use it or lose it rule as well. There is no rollover feature for the daycare flex. You have a 2.5 month extension in order to spend your daycare flexible spending account money. The big change is that your dental rates are going up. So for 2021, MetLife lowered our rates due to the underusage and your inability to visit a dentist. So they lowered the rates due to the coronavirus. Now that people can get back to their dentist and utilize the benefits again, the rates are going to go back up. So your classic and your low option, those rates are going to go back to what they were in 2020. So we'll see those rates going back up. If you were in the high option, you will actually see an increase over what the rates were in 2020. So that plan did see an increase. This is the only benefit that saw a change in the premiums. So just be aware that your rates for dental are going to go up in 2022. There are some other plans that we always like to point out under the NCFlex program, the cancer plan being one of them. In the past, the vendor has always waived an evidence of insuranceability form if you wanted to sign up for cancer outside your initial enrollment period. In 2022, they've done away with that, and you now will need an evidence of insuranceability form if you wish to enroll in the cancer plan and you've denied it in the past. So if you want to increase your cancer coverage as well, that will also trigger an evidence of insuranceability form to be completed. So just be aware of that change. If you have the cancer coverage, please make sure you're filing your wellness credit. If you're in the low plan, you can receive a $25 wellness credit. If you're in the high or the premium, the wellness credit is $100, and that's for maintaining a healthy lifestyle by receiving a mammogram, a pap smear, cholesterol blood test, prostate blood test. There's a whole list of wellness credits, wellness exams that you can complete in order to receive that wellness credit. So make sure you're not leaving any money on the table and file those wellness claims. With the Voya term life insurance, if you have that coverage, you can gradually increase this benefit every year by $10,000 or $20,000 without question, up until the guaranteed issue amount of $200,000. If you've declined the term life insurance policy in the past, you can start with a $10,000 or $20,000 limit without question. If you increase your current coverage by more than 20, that will trigger a evidence of insuranceability requirement. Or if you signing up for it for the first time for more than $10,000 or $20,000, that will also trigger an evidence of insuranceability form. And as I mentioned, there's no changes to the accident, vision, critical illness, or the accidental death and dismemberment plan. As you go through the open enrollment process, you do want to make sure that you are checking to see that you do have the free core AD&D coverage. That's $10,000 worth of accidental death and dismemberment provided at no cost. Typically what happens is people will go through the open enrollment process and see $10,000 of AD&D. I don't want to pay for that, and they'll decline it, but it's what? Free. The state doesn't give you a lot of things for free, so please make sure you're signing up for it. The reason you have to sign up is because you need to assign a beneficiary to it. Our online portal to complete that is the eBenefits platform. This is go to the Human Resources website, and once the open enrollment platform's opened, you'll be able to click on it using your UNCG credentials, and it will open up into this e-portal, and you will click that yellow Get Started button. It won't be for a qualifying life event. It'll be Get Started for your open enrollment. This is just a generic screenshot. The reason we're showing you this is so that you know what the portal looks like for other reasons. You can access this at any time during the plan year, not just during open enrollment. If you ever needed to update your primary care provider, there is a link under Manage Your Account that would allow you to do that. So you can update your primary care provider at any time during the plan year. They just ask for you to give them 5 days in order for that new primary care provider to be in the system before you actually visit the doctor. At the bottom of that menu, you can see quick links. These are links for all of the NCFlex benefits and the state health plan, CVS Caremark. All of these links will open up directly into the vendor's website using your UNCG credentials. So you no longer have to remember an ID and a password for the vision website, an ID and a password for the dental pass website. Now your UNCG ID and password will open up these quick links automatically, go directly to these websites, track a claim, print an ID card, find providers. So this is going to save you time and save you brain cells because you no longer have to remember 8 different IDs and passwords. Again, your UNCG ID and password credential will get you directly into these websites. Now, the caveat is you will have had to have logged in and registered for these websites at some point. So it's always a good idea to do it. So here are some successful enrollment tips. When you log into the e-benefits portal, you want to make sure that your contact information is up to date. And if you go to the profile, which will be on the upper left-hand side of the menus, you can click on your profile and make sure that your mailing address is correct. This is the address that your ID cards will be mailed. So make sure your contact information is up to date. Make sure you've entered and updated your dependent information with the correct date of birth and that the social security number is there for all of your dependents. This is a perfect opportunity for you to make sure that you have beneficiaries listed for those policies that require them, the term life insurance, the accidental death and dismemberment, the critical illness and cancer plans all have the ability to have beneficiaries on those plans. So make sure they're there. And if you have them, make sure they're up to date. When you complete your online enrollment process, make sure you print a confirmation statement. If there's ever a question about what benefits you've elected or that you haven't completed the enrollment process, your confirmation statement is documentation that will help correct all the issues that might have resulted from the errors. So having that confirmation statement, do a screenshot, save it on your phone, print it, do something that will help your HR benefit specialist who are going to bat for you to get these changes that need to happen as a result of errors during the open enrollment process. That's going to be a nice help. So make sure you print that, take a screenshot of it. Any questions? You can change your name in the profile. If you've changed your name, you want to make sure that you've updated it in UNCG. If you ever make changes in UNCG, it's really a 2-step process because while Genie will communicate with the payroll banner system, it will not communicate to the e-benefits portal. So if you ever make a change to your name or address in Genie, you do have to reach out to the benefits team so we can make that change for you as well. But you should be able to change it in your profile. Yes, the open enrollment dates are November 11th through the 29th.
It's October, right, Stephen?
I'm sorry,
November.
yes, October, sorry.
It's okay.
Yes. More about them. So the only wellness credit we have is the tobacco attestation credit. So if you can attest to being a non-smoker, simply answering the question in the online enrollment process, you'll save $60. If you are a smoker willing to participate in the tobacco attestation program, you can save $60 as well if you visit your primary care provider or a CVS Minute Clinic. Thank you. You will get multiple notices from the state health plan as well as your human resources department about open enrollment. Please don't ignore them. What other questions do you have? Great. If you have questions, you know how to reach me.
Thank you so much for your time, Stephen. This is
You're
very
very
helpful to hear the changes and reminders for the upcoming open enrollment.